My name is Stephanie Izzard. I am the executive assistant to Dr. K, who is the medical officer for Montgomery County Public School. And I think we're joined by our collaborator from Montgomery Goes Purple, Ms. Laura Mitchell. And we want to just highlight the opioid overdose crisis. It's not just in the county, but it's nationwide, statewide, and local. And so Dr. K is going to share an important message for our parents tonight. So Dr. K, I'm going to turn it over to you.
Thank you very much. And thanks to everybody for having us. I also want to introduce Dr. Kyle Potter from our office, who is also part of our team in doing this work. So Ms. Izzard, Dr. Potter, and Ms. Mitchell are all here with me tonight to help bring to you some information about what you might have already been hearing in the news with regards to fentanyl and overdoses that are happening in youth, not just in Montgomery, as Ms. Izzard said, but all over the country. So this is a national public health crisis. You've heard about it possibly through your own students or children at school or in the community, but it's something that we really are seeing around the state, in other counties that are close to us, and across the whole nation. Overdoses due to opioid type medications has been a problem for a very long time. What's new and what's different is that more and more often these deaths and overdoses that are not fatal are increasing, and they're increasingly due to illegally made fentanyl. Fentanyl is a medication that is prescribed for pain. It's a very strong opioid, which means it's related to medicines like morphine. And we usually prescribe it in the hospital or in situations where there's very severe pain and often more medical monitoring. But now that it can be made illegally in labs, it is showing up in our illegal drug supply and really driving up the rates of overdoses and death. We saw this in adults and the general population, and really, really worrisome is now that we're seeing it happen more and more often in young people. So we have been talking about awareness of what has been going on. Our team here, Montgomery Goes Purple, and Ms. Izzard and Ms. Mitchell, Dr. Potter, they've been talking about and doing this work for years before I came here, but this year, the county leaders, school leadership has really been trying to accelerate the message. You may have seen messages come out from the schools about safety in terms of the physical safety of our school environment, and another part of maintaining a drug-free environment are updates and to our curriculum, as well as other types of education that we bring out to the community like this. Our office also works to connect schools with community programming that is related to substance use prevention and response, and works with the Department of Health to bring programs and youth supports into schools. And one thing that's really important to us is offering resources to families and parents so they can feel empowered, not just with the knowledge about what's going on, but having more support in terms of how to act if you're concerned, what to look for, what to do, how to have conversations. So this has become a lot of our work, empowering not only parents, youth as well. And you may have heard a lot about the emergency overdose medication naloxone, which is a medicine that if you have an overdose from an opioid, including fentanyl, can temporarily reverse the effects. So we'll talk more about these things as we go through the presentation. Now, these data are updated data. They're collected that show emergency department visits in the under 18 age group in Montgomery County. They're collected by our Health and Human Services department, and orange is the number of opioid related visits to the emergency room, and blue is the number of opioid poisoning or really toxic overdoses. And you can see and fiscal year in the county starts in July, I believe. So it's almost like the academic year. So you can see how really in the past 3 years, the number of opioid-related visits to emergency rooms in young people has really increased dramatically compared to the pattern from 2017 to 2021, from 2021 to 2022, and now not even to the end of fiscal year 2023, we're seeing much higher rates than in previous years. We've also, in some settings, shared data by our police department partners, which it looks a little different because it represents, for example, calls to 911 and first responders. But any way that we look at the data from the police's point of view, from emergency rooms, from what's happening in schools, it all shows the same trend, that this is happening to more and more youth. So where are we now? We are, getting close to May during the school year, and there's been a lot of energy. We are grateful for our county leaders, our other community organizations, school leadership, and our parents and youth partners for really getting energized around this subject. So there are 4 important points I want to make about how the work has evolved. One, the addressing overdoses involves looking at the entire spectrum of substance use, from prevention, identifying risk factors, doing public health education, modifying risk factors, harm reduction, treatment, and then recovery support after treatment. So we talk a lot about Narcan and overdoses, but I want to make sure everybody understands that really making an impact on this problem means having to look at the entire spectrum of support that people need. And it's also something that we do with all hands on deck, right? So we think about how to care for our kids in all the spaces they are in their communities. Unfortunately, most of the overdoses that happen don't happen in school. So we need to make sure that kids are safe everywhere that they are. So as public schools, we have a unique opportunity to get to know kids and speak with parents, but we really depend on partnerships with our public health and public safety agencies, with county leaders and community groups. And we have this great collaboration called Montgomery Goes Purple that helps everybody put their minds together and efforts together around community-based initiatives that we can do together. A third point is that when we talk about fentanyl and opioid overdose, we really want to make sure that we're thinking about a comprehensive mental health framework and understand that this doesn't occur in a vacuum, right? So we have to talk about the spectrum of substance use in general, and also just pan out and understand that this is a really complex time for talking, for responding to, and for looking together for solutions to the mental health crisis that existed before the pandemic among youth, and that the Surgeon General pointed out really seemed to get worse during the pandemic. So this is one piece of a larger effort of our community to think more intentionally about the complex mental health needs that we're dealing with today. And then lastly, as I mentioned, we're very serious about youth and family engagement, and understanding that All Together Now means also equipping youth and their parents with the knowledge and skills they need to take care of themselves and others. That is a really, really critical central part of this work. That none of us are alone, but parents, caregivers, family members are, very, very important, sometimes the most important allies in their kids' well-being and health. And also that youth can be empowered for their own health, but they are very generous and want to know how to take care of each other. We've heard all of these messages come out as folks have stepped forward wanting to do more about this serious public health crisis. And we will share this information, so you don't need to memorize it. I just want to show, just in general, that there are things that we do in the school system in terms of our role as educators, keeping our environment safe, understanding how we work on our emergency procedures and what types of programming we offer in the school setting. But we also have partnerships with outside organizations, the Department of Health and Human Services, Prevention and Harm Reduction Services. we partner very closely with. They are experts in substance use and talking to youth, and they come into schools and do school-based assemblies, for example, or even other types of more personal outreach. And we have partnered with them to bring adolescent substance use prevention groups into some high schools, which are growing and which have been very popular, and that students have volunteered to come join and really given us great feedback on. We also have a great partnership with Shepherd Pratt for students who are in recovery from substance use. And it's a special program where they can continue their education with their home schools in a supported way, while also being able to receive treatment or recovery support on a daily basis. Some other things that are going on at the county level for Health and Human Services is Be the One. If you haven't checked out this website, I highly recommend it. It's really well directed towards youth around substance use and mental health and suicide prevention. There's also a service called CAS. You might have formerly known this as SASCA. Child and Adolescent Assessment Services does free assessments and evaluations with regards to substance use. They're co-located with the Montgomery County Crisis Center, and they will do an evaluation and make recommendations for any youth in Montgomery County. And then Prevention and Harm, in addition to partnering with us, they offer Narcan training and distribution, which they have helped us with at our community-wide forums, and they have some other services for county residents. As far as outpatient treatment, there is more than the ones listed, but these are two big programs that work closely with the county. There is a addiction outpatient program at Suburban Hospital and a more intensive one at Journeys. The need for more treatment programs, treatment services, especially for higher levels of acuity or folks who need more support, is something that we are working on as a county and as a state to make more possible. Because right now there's simply not enough resources, especially these higher level, more intense resources in Montgomery County and even in the state of Maryland. So this is the type of community engagement that we have been doing, outreach through various parent organizations who we feel so privileged to be able to speak to. And we can also, we'll also be talking more about different parent training opportunities that you may be able to take advantage of. I talked already about some of the school-based community conversations we've been having with students, our school-based groups with our DHHS partners, and student leadership and the student youth media, the school newspapers. They've all come forward and are really wanting to mobilize around this issue that they're seeing in their schools and are worried about amongst their peers. And then our communications department is working on more youth-centered PSAs, for example, and online resources. For everybody, we have had 3 very popular family forums on fentanyl, which have reached I would say over 2,500 people. You may have seen our community messages. We also have more online resources now. And we have really talked a lot about making sure people know about what to do in a crisis, and talking and thinking about naloxone, as I mentioned. We often are asked, well, what can I do to help? So we are telling everyone, the first thing to do is increase your knowledge. This is a very unique time. I think we've heard that over the past few years. This is a unique and unprecedented time, but there definitely are unique elements to the fentanyl crisis in terms of it being a very powerful drug that seems just increasingly available, that is deadly in even small amounts, and has just infiltrated our illegal drug supply, not just in the form of counterfeit pills that students may take intentionally, but other types of illicit pills that they may not know what is actually in it, as well as other types of substances. We've even found it in things like gummies and edibles and vape liquid. So this is like a very different type of drug landscape and different type of risks than some people might remember from earlier times. We also want everybody to use non-stigmatizing language when talking about substance use. This is something that you actually have to be very intentional and careful about in practice, even for me. And I talk about health topics and this topic quite a lot. Mental health issues have a lot of stigma around them already, and there's so many barriers to coming forward. And then some of the language that we use, talking about being clean or being dirty, those can be real barriers and add to shame that folks might have that might prevent them from coming forward. So we have some great resources for non-stigmatizing language just to be mindful of. I think everybody should at least learn about naloxone and consider whether or not that's something that they should learn how to use or have in their home. And then learning about mental health resources, especially crisis resources. For parents, I think it's really important to, speak to your kids about the dangers of drug use, what your personal and family expectations are around use and available supports. We might sometimes think kids know how we feel, and sometimes we feel like they don't listen when we tell them, but it's really important to be explicit when we're living during a time where things might seem normal, including substance use, that you might feel very strongly about your kids not doing. So like making it clear what your expectations, what your family beliefs and values are is really important, as well as communicating to your kids that you will be there to help. Oftentimes, as a teen specialist, people ask me, why doesn't my teenager tell me about this? And sometimes it's hard for kids to have these types of conversations. So we do a lot of talking in our workshops about, how do I come forward? How do I engage with my parents? How do I talk to my kids about some of these more difficult topics? It's not always intuitive, right? And then we really hope that everyone will learn to recognize signs of when kids are struggling, when anyone is struggling with their mental health or is at risk of substance use early on, knowing that trauma, mental health, these are things that increase the risk of having problems with substance use, but also recognizing them early and setting the standard for it's okay to talk about and you can always come to me is really important. Youth are really powerful communicators to each other. So by engaging them, we hope not only to empower them with knowledge, but that they will spread knowledge to their peers. And because youth can be generous and worried sometimes more about other people's health than what will happen to them, what we have been hearing from them is they want to know how to support their friends, how to support family members they might be worried about. So these are the different things when we are sort of engaging with community members and asking and answering their questions that have come up and that we've made the focus of some of our workshops or our sessions, our educational sessions in our district-wide forums. Now I'll just go through some resources. If you go to the MCPS website and type in medical officer, you'll find links to the various community message with resources. And we're also building under this one pill, one kill column, different resources. There's also a link specifically to the MCPS fentanyl page, which if you missed any of our family forums, you can see video recordings, and there are short videos that are youth directed about the dangers of fentanyl. Montgomery Goes Purple has a youth and family resources section that is excellent and has huge folders of great resources, flyers for different peer support group opportunities, as well as training opportunities for parents, crisis resources, and training, online training for Narcan, links to signing up for the county training and other information just about how to use Narcan and where to get it. One thing I wanted to just highlight specifically is the importance of medication safety at home. You may have been worried about hearing in the news younger students, accidentally ingesting pills that they thought were candy and having having toxic experiences with that. In MCPS, as early as kindergarten, medication safety is part of our curriculum. So we, talk about not taking medicine, not taking pills that you find, even if it looks like candy. Don't take things from strangers or from anyone who's not a parent, and anything that's not been prescribed by your doctor or that your family member is giving you for something specific. And then also making sure that access to medications at home, that you're throwing out or turning in expired medications, and if medications are really powerful and possibly dangerous like opioids, that they are secured, maybe even a medication lockbox. The key crisis information we want everybody knowing that we share at every opportunity is overdose is a medical emergency. So if you don't have Narcan, and even if you do, you always need to call 911. If you see someone is not breathing, unresponsive, has blue lips. A lot of the Narcan training will also go over recognizing overdoses and what to do in that case. As far as mental health emergencies, you may have heard of the National Suicide Hotline. It is now so simple, 988. And the MCPS Stronger Student app has like a direct button that also calls 988. And in Montgomery County, we have the Crisis Center, which is open 24/7, and you can call them, you can walk in. They have a mobile crisis unit that can come out into the county for folks who are not able to go to the crisis center or otherwise leave where they are for emergency mental health assessment. Another great thing that's made free by the state of Maryland is parent craft training. This is like online video training, but I find that it's very helpful and talks more broadly about substance use. And then another great parent resource is the Recovery Research Institute. They have some great graphics and a very comprehensive guide for family members. These are, some of the things that we talked about, making sure that you set your expectations through both modeling and explicit conversations. It talks more specifically about setting limits, being consistent. So you've heard a lot of this in sort of other contexts, but with the specific respect to substance use conversations, it gives a lot of really helpful information. And the last thing that we want to leave everybody with is that, self-care is more challenging, more important than ever before in terms of being a great adult ally or being the best adult ally that you can. As I know, as a parent myself, I am not the best at putting my needs before everyone else's in my family. And that's something that I'm constantly working on. And luckily my kids are old enough now that they call me out about. And it seems like there's less time for everything, right? And everybody needs more time. So just being very mindful and intentional that it's okay. Not only is it okay to make sure that you're taking good care of yourself, but that it's necessary and critical to being an adult ally, because you are the most important adult ally in your child's life, right? And going with that, this Saturday, I would love to invite you all to Magruder High School to our Health and Wellness Fair. We have evolved from talking and centering our district forums around fentanyl and substance use to responding to our conversations with our community about wanting more in terms of learning to connect with each other and supporting their own wellness. So a lot of the sessions, there will be an opportunity for Narcan training and distribution, but we'll also be having sessions about supporting the emotional well-being of your teen, health for student athletes, and fun things like kickboxing and Zumba. It's going to be 4 sessions that rotate and repeat, so you'll be able to, between 9 and 12 o'clock, attend up to 4 of these different sessions. So it should be great. We got a lot of great feedback from our last forum, and what's special about this one is that we're really focusing more on or broadening our focus to include how to be the best adult allies that we can and communicate with each other and with our teens. All right. that is what we have for you today, and we are more than happy to answer your questions.